The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Good morning and Happy New Year's. On today's show on Aging Horizons, we'll be talking to your Welcome to Medicare visit with your physician. We'll be talking about what it is, why it's important, and what can come out as a result of that, basically a screening, so they can address possibly any medical issues that you might not know about, but also to get a baseline of where you're at. So stay tuned, we'll be right back.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
I was outside working on some equipment, nothing too strenuous. I started sweating and feeling out of breath.
When he felt pressure in his chest and aching in his arms, I knew we had to call 911.
First responders were there before we knew it. 38 minutes later, the doctors had restored the blood flow to my heart.
Now we know dialing 911 saved his life.
Your life is on the line.
This message sponsored by Mission Lifeline Montana.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
Sometimes the difference between having the life-saving medications you need and going without is the premium on your Medicare drug insurance. If you are a Montana resident enrolled in the Medicare prescription drug program, you may be eligible to receive help with your premiums, even if you own your home or other assets or think you may have too much income. Call or visit the Big Sky RX website today to find out if you qualify.
There you go, ma'am. See you next month.
Thank you.
Welcome to Aging Horizons, which is brought to you by the Department of Public Health and Human Services. On today's show, we have Dr. Michael Temporal. You're a family physician down here in Billings, and he just did a wonderful presentation at the 51st Annual Governor's Conference on Aging. And doctor, we're talking about Welcome to Medicare Physical. It's not really a physical, is it? It's something a little different.
Right. Yeah, the Medicare Welcome to Medicare or Medicare Annual Wellness Visit is actually a screening visit and not as much a physical examination. Yeah. It's a benefit that was developed from the Affordable Care Act and has been around now for about 9 years. Yeah. And the utility of it, despite it being a free, no copay benefit to patients, as well as an additional benefit within the Medicare Advantage plans, is still an underutilized service. Yeah. And still probably less than 50% of eligible people have completed an annual wellness visit.
And how is a visit different than a physical that we're used to? And maybe do we need to still get a physical every year?
Yeah. So, and I think that that's probably the biggest distinction and misunderstanding about what the annual wellness visit is. Because when you were younger, and certainly when you were a kid, you'd have regular annual exams, regular physical examinations. And Medicare doesn't cover an annual examination. They will cover a comprehensive review of your medical issues, but because of that, they also cover now the annual wellness visit, which is really an opportunity to screen and identify some of the health issues that influence the diseases that you may have, as well as talk about things that you wouldn't traditionally think about in an office visit with your doctor.
And the result of these is that you start getting a baseline, right? Can you tell us how important a baseline of how you are is important?
Sure. The annual wellness visit includes a health risk assessment. So it's going to ask questions about your feelings of safety, your ability to do basic activities and self-care activities, your ability to do instrumental activities or those activities that are important to living independently. It'll ask about your risk of falls, your concerns or risk for memory problems, for mood issues, things that, are important to identify, because if we can manage them earlier in life, earlier in our Medicare lives, then it may make a big difference over the course of your life as a Medicare beneficiary.
Now, through these reviews, I guess we'll say, have you found issues with individuals that they didn't know about, or it brought up certain things that we need to address now?
Yeah, so I think some of the benefits of having the Medicare wellness visit is to develop those plans. And, a lot of people don't come in for this exam and then miss the opportunities for cancer screenings, to catch up and maintain immunization status, to get cognitive screening, depression screening, fall risk assessment. Because more often than not, the patients who have memory problems or who may have social isolation or depression or things like that are less likely to come in. And if we can get them in for these visits and do these sorts of assessments, then we can intervene and identify problems earlier.
Now, I thought I heard somewhere that many times an individual is hesitant to go to a physician because they're frightened of something being found, right? And have you seen that, or you think that might be an issue here?
Yeah. Well, I think that again, is when people are thinking about their traditional health visit, that includes a physical examination, some laboratory testing, those sorts of things. Those are opportunities to identify health problems, but the annual wellness visit is different. So it doesn't include as much of the physical examination, but it will review your medical history. It'll look at social factors that may be impacting your health. It'll ask about some of those other things going on, which then could lead to further evaluation and follow-up office visits with that team.
Yeah, so you can set up, I'll say a plan of treatment. I don't have a better term, but many times it's pretty simple. It doesn't require a shot, right? It's just a change in lifestyle, and you have resources you can refer them to.
So what should come from an annual wellness visit is a plan of care, which should have some recommendations about lifestyle, screening recommendations for diabetes risk, heart risk, things like that, an outline of what, given the health status that you have, what are the important kind of screening tests or follow-up things that should be addressed specific to you, and then kind of anticipate what's going to be important over the next couple of years as well.
Well, I went to my regular physician for my checkup just this year, and I was talking to a physician's assistant, I'll say, that did this. I didn't really talk to the physician. But I know a lot of people don't have a primary care physician. And why is that important?
Well, and true. And in fact, an annual wellness visit needs to be done by a licensed provider or under the supervision of the physician. But it doesn't necessarily have to be done by the physician. Or the participation of the physician may be kind of abbreviated. And so a nurse practitioner, a physician assistant, a social worker, a licensed clinical social worker, a pharmacist can all complete annual wellness visits. An RN can do it in the office while I'm there, and I can come in and visit with the patient before or after the visit to do that. And so, you may not spend all of that time with your doctor at that visit, but a lot of things are going to happen at that visit.
Yep, they'll review the forms and everything that's there, and then they'll see if they need to do a treatment plan, right?
Well, you'll come home with a treatment plan because there's always going to be some recommendations. And one of the other things that's important about an annual wellness visit is an opportunity to kind of anticipate and plan ahead. And so advanced care planning can be really important as we get older and as our health status changes. And the worst thing is to be in an emergency room or in the hospital and not be able to tell them what you want or don't want done. And if we can, in a relaxed setting in the office, talk about that, complete those documents. That can be important.
And then you can get a baseline so that they know what's normal for you and what is off. Now we'll continue our discussion about the Medicare annual review and in our next segment, so stay tuned.
When I stopped showing up, Jim showed up at my door. He took me to the hospital in town to get me help. That's the day Jim saved my life.
Everyone has a role to play in preventing suicide. Know the signs and don't be afraid to speak up. If someone you know is in crisis or emotional distress, the only wrong thing to say is nothing at all. Call 800-273-TALK or text MT to 741-741.
Questions about Medicare and other types of insurance? Contact the State Health Insurance Assistance Program office to get answers to questions like, what is the difference between Medicare and Medicaid? And how do you decide if you need Medicare supplemental insurance? This insurance counseling program is not a sales program. It is available to provide answers to your insurance questions. For more information, call the State Health Insurance Assistance Program office at 1-800-332-2272.
I have so many questions about power of attorney.
Well, some powers of attorney are for finances and others are for healthcare decisions.
A power of attorney designates an agent who would make decisions on your behalf.
While making a power of attorney, you have the ability to control your agent's power.
You also have the ability to decide when that POA would take effect.
Wait, am I giving away all my rights?
Power of attorney isn't a license to make any decision for you, just those that you've specified.
Your agent should be somebody that's working in your best interest, but it should also be somebody that you would trust.
What if they try to abuse their power?
Protective measures like third-party accounting, secondary signatures, defined spending and gifting limits can help protect against financial exploitation. An agent's powers can always be limited by a customized power of attorney, and they can be revoked by you or the court if the power of attorney is abused.
So carefully drafted estate planning documents can help ensure that your finances are monitored, but not abused.
If you or someone you know is being exploited, please report to Aging Services Bureau at 844-277-9300 or the Legal Service Developer at 1-800-332-2272. This message sponsored by the DPHHS Aging Service Bureau.
Hi folks, welcome back to Aging Horizons. I'm your host, Brian Lamore, and we're interviewing or talking with Dr. Michael Temporal here in Billings, and we're talking about your first Medicare visit. And doctor, what are some of the things that a person might want to prepare prior to that visit?
So the Welcome to Medicare visit is you're eligible as a benefit in those first 12 months that you qualify for Medicare. If it's after that, it's called an annual wellness visit and can be done every 12 months. And then if you're in a Medicare Advantage plan, they have some different, interval requirements. But really to anticipate and prepare for the annual Medicare annual wellness visit, it's important to bring any records that you might have. Recent immunizations, if you've had any recent testing done or health screenings that the provider may not already know of, can be important. The names of other important healthcare providers, if you see a cardiologist, a kidney specialist, a lung doctor, if you work with a physical therapist on a regular basis, if you have, contact with a home health agency or something like that, that kind of information can help prepare for the visit. And then, recognizing that there's going to be a lot of questions.
Yes.
And so you may have a health risk assessment questionnaire filled out while you're waiting to be seen, or you will be asked a lot of questions during that visit, and things that you wouldn't expect to be asked at a regular office visit.
Yeah. But there are questions you can answer.
Oh yeah,
no surprise questions.
No surprise questions.
But now, doctor, you mentioned a number of specialists. Let's say if a person is seeing 3 specialists and they come in for their annual wellness checkup, how would that affect the services? Would the general physician kind of help to coordinate or point out different things? How does it help that individual?
Well, I think every patient deserves a primary care provider, whether that be a family physician, nurse practitioner, physician assistant, general internist, because you need a quarterback to kind of pull together everything that's going on. And the Medicare annual wellness visit is that opportunity to kind of take all the different pieces that you're involved with and consolidate it into something so that you and your primary care physician know what's going on, what to expect, and who to contact. And so, oftentimes, you may see your kidney specialist or your heart specialist, and they don't have the opportunity to really address some of the other things that are also important to your life. And so that primary care physician, that relationship that you have, and through the annual wellness visit, is that opportunity to bring it all together.
So they get an understanding, I guess, a baseline of how you are, maybe how you're changing every year, which can complement your coordination of care, which is, of course, wonderful, and it's so important. Trying to think what else. So now it's an annual, and I remember interviewing another physician at one time said, do this around your birthday because you never forget your birthday, right? How hard is it for people to remember? Do you see people that are not following up?
Yeah, well, so, it is an annual benefit, and so in straight Medicare, it needs to be done every 12 months, or at least a 12-month interval since the last visit. Under Medicare Advantage plans, they'll often do it by calendar year. So you could get one in October of this year and then in February of next year, but you would only get one a year. And part of the important screenings will be a memory questions and mood questions and things that that you may not identify as an issue, but are important to screen for because, again, finding those and anticipating, planning for is going to be really important.
Yeah, and you can work with some of those specialists. You can point out certain things that are happening and maybe get another specialist, right, if required.
Yeah, and it doesn't even have to be a traditional medical specialist. We may identify together that transportation or nutritional issues are important, and visiting with a dietitian or a social worker or a pharmacist to clarify the medication understanding, or an audiology evaluation or something else separate from your traditional medical doctor disease management kind of things can be uncovered. And again, we got the time, we explore beyond, disease to figure out what's right and what's needed for you at this time.
Kind of a whole body assessment. And I'm thinking then you can coordinate these different programs that are being offered. But I like what you said is this goes well beyond the medical model in that I imagine people aren't aware sometimes of what they need. Then can you refer them to Medicare providers, or are there non-Medicare providers? Do you help with that?
So oftentimes we will generate a series of recommendations from this visit, and you should go home with a written document that gives you a plan, something even as a checkoff. Did I get these things done over the course of the coming year? And more often than not, they will require Medicare will require an order from the physician or the advanced practice provider for physical therapy, for a referral, for the mammogram, or, well, maybe not the mammogram, but a colonoscopy or a tetanus shot or things like that. The Medicare rules will still apply for them to cover the services. And there's some great apps available that can tell you what Medicare covers and doesn't cover. Yeah.
Well, no, we're concerned about the individual's health, but Medicare is also concerned about the cost. And this helps address some cost issues, doesn't it?
Yeah. I think that, the data would suggest that if enough people had the annual wellness visit and we can identify and intervene, the goal of this would be to keep you out of the hospital, keep you out of the emergency room. And so while it may have more upfront costs, the total savings over the total cost of care can be improved.
And I think that all translates into a longer, better life, right?
Yes.
And that's what we're all concerned about, what we want to have in our life. By doing the annual physical or the Welcome to Medicare review, they define what baseline is for you. What is normal? Normal isn't normal amongst all people. There are variations, but we want to keep it that way for you. Stay tuned. We'll be right back.
No one likes to have to ask for help. It's a courageous act.
Sarah Solomon, Energy Share Coordinator.
Our clients work hard, sometimes at 2 or even 3 jobs, but still struggle to keep the heat on. They're doing everything they can. They're proud and they don't give up. I feel inspired and honored to work together with these Montana families.
To donate, call 888-779-7589 or go to EnergyShareMT.com. EnergyShare, you can help your neighbor stay warm.
Here in Montana, we love our outdoor activities. Unfortunately, few of them are risk-free. Indeed, Montana is second in the nation per capita in head injuries that can destroy the lives of people we love. That's why you should insist your family always wear protective helmets. But you can do even more. When you fill out your vehicle registration this year, circle the Y and donate $1 to support traumatic brain injury prevention and education. Now that's using the old noggin.
With as many as 1 in 10 Americans at risk for Alzheimer's or some other form of dementia, chances are someone you know and love will receive that diagnosis. When that happens, you may well feel devastated, but know that you are not alone. Help is available. You don't have to face dementia by yourself. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
Welcome back to Aging Horizons. I'm your host, Brian Lamore, and we're continuing our discussion with Dr. Michael Temporal. He's a physician down here in Billings, and we're talking about Medicare, and particularly we're talking about the Welcome to Medicare and your annual Medicare review. Now, what is the incentive to get your initial Welcome to Medicare review?
Sure. Well, the annual Medicare wellness visit or the Welcome to Medicare examination is a benefit that has no copay attached to it. But it's important to remember that if you're coming in for your medication renewals, if you're coming in to review your lab test results, if you're coming in for follow-up on your diabetes, your asthma, your overweight or smoking and things like that, those are a separate visit. They can be done at the time of an annual wellness visit, but will look like two separate encounters on that day of visit. And so the annual wellness visit has no copay. Your regular office visit or testing may have a copay attached depending on your insurance plan.
Yeah. And the annual visit, how does it differ from the Welcome to Medicare? Is it kind of that and more?
Well, so your Welcome to Medicare visit is the same thing as an initial Welcome to Medicare visit. Or excuse me, an initial annual wellness visit, but is only billed out that first time out, whether it's during the first 12 months of your qualification as a Medicare beneficiary or not. If it's more than that, then it becomes your initial wellness visit. Your subsequent wellness visit, then done after 12 months from that first one, is an update and review. So may not have to take as long as that first one did, but will cover the same kinds of prevention and advanced planning kind of things.
One of those things, and check the checklist, see how you've done over the year, set up another checklist for the remaining year, but there may be a copay to that.
No, so if it's a wellness visit, initial or subsequent, and it's a wellness visit, but you need to make sure that when you schedule it as an annual wellness visit, there's no copay to that. But it's not a regular physical examination.
Okay. Well, how important is it to have an annual physical? And you might want to do both at the same time if it's important, right?
Yeah. Well, you know, I think that the value of a general physical examination, kind of head to toe kind of thing, has its merits. The studies would suggest that maybe the value is not as much as we in the healthcare field would like to think it is. But there are a lot of expectations from patients that this is part of what they get. But that's different than the annual wellness visit. But it's still important if you have any chronic illnesses, if you have other questions or concerns about your health that can be addressed from separate from acute care problems. But again, the annual wellness visit is that opportunity to look at the total picture and identify what needs to be done in this coming year.
Okay, now imagine you have a physical and there's something that you would like to know more information on. You'd run some tests. On the annual review, you probably don't do that, do you?
No, it may result in us generating orders for those things.
Yes.
And it may say you need an order for your mammogram or your PSA test or any number of different things. But those, again, are separate from the wellness benefit and would be something that we would follow up with.
Yeah, and the annual physical, it might delve a little further into the details of your health, right?
Yeah.
Yeah, and through that review, well, you can get new paths of treatment,
Sure.
so you can live longer and happier.
Mm-hmm.
Well, you know, when we talk about living happier too, that's a part of the annual review, right? You want to make sure that people are happy, and what are some of the things that can take away from our happiness?
Yeah, well, and I think that that's where the wellness visit kind of addresses some of this. Mm-hmm. If I have social isolation, if I have unhealthy habits, if I have, concerns about things that impact my health, but you wouldn't think about. I don't have access to food regularly, or I don't have access to healthy food. I don't have good transportation services to get me places. I am not able to afford my medications. Or I have undiagnosed depression, or I have memory problems that, nobody's ever noticed. Then, those can have a great impact on your life, and, can be something that your family members or your friends have kind of wondered about, but never, no one has ever asked you about.
Yeah.
And so, again, this is a comprehensive screening that, kind of looks at the things that we wouldn't normally think about at a regular physical exam.
Yeah. Well, I know when my mother was alive, we'd go to the doctor. How you doing? Oh, fine. Don't know why I'm here. Oh, wait. I got a list.
Yeah.
Well, I was going with her to her physical, which was just fine, but now we have HIPAA and everything, and you need to bring this up many times. Your friends, your other individuals who are noticing deficits, it's up to you to tell them, right?
Yeah, so the annual wellness visit can screen for some of those things.
Yes.
If you come in with a list of, I want to make sure this, and this are done, or I have questions about my back and my shoulder and my heart and things like that, that becomes more of a regular physical exam office visit. So that's going to be carved out from the annual wellness visit. Okay, so it actually then becomes two episodes of care that may or may not be done in that same period of time. But they're two different things.
Well, but the annual review will identify the additional things, and if they feel they have to do it right now, blood test, whatever, you'll do that, right? And it'll be separate. It'll be a different charge for it, a copay, but you're not paying full boat like other people.
No. Definitely not.
Well, we're drawn to a close on the show. What is the idea you'd like to leave with our viewers about how important this review is?
Well, thank you. The annual wellness visit, again, is a benefit and helps you to work with your healthcare provider to come up with a plan of what's important to you, what should be done and what could be done, and then maybe a roadmap to getting some of that done. There can be a lot of questions around it, and providers may not be as versed to it as they should be. And going to Medicare.gov is an opportunity to look at the annual wellness visit, look at the components, see what's covered and what's not covered.
And then you can work on addressing it. Thank you so much for being here, and our viewers, thank you for tuning in.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.